Hello and Assalamualaikum. My name is Putri Balkis binti Rohaidi. Entry number was 07560. Today I will present about consideration and adaptation when providing basilar support to the patient and pregnant. First, we need to do assessment and initial start. We need to check responsive and breathing and assess her responsive and breathing, call emergency if something abnormal seen. Secondly is activate the NEMS. Ensure emergency medical services are active. Call 911 immediately. And the last one is position. We need to position on her left side to relieve pressure. We doesn't want to do pressure to the mother's belly. And the second one is the airway and breathing. We need to open the airway and using the heart chin lift maneuver to open the airway and rescue breath. If she not breathing, give to rescue breath after checking airway. Third one is chest compression. The chest compression to the pregnant woman are slightly different between the normal person. The compression technique for the performs chest compression center of the chest slightly above than usual position because we doesn't want to the pressure to the patient belly. And the hand placement keep the chain still same with the normal is the center of the chest. The fourth one is the defibrillation as a special consideration. If the patient still need is if patient still doesn't alive, we need consider to use AED if provided, and manual displacement. If a woman is cardiac arrest, manual displace the uterus to the left to the relief pressure. And for the advanced care, ensure advanced life support is rotated. And for the last one is post resuscitation care after the basic life support is provided. We need to monitoring and the hospital care transfer to the facility capable to provide advanced treatment to the patients.
I am Fatin Yashaira binti Zaami. So I will talk about implant defibrillators. So first, we need to check for danger for ourselves, bystanders and the casualty. Next, check for response. We use the cause technique. C for can you hear me? O open your eyes. W what is your name? S squeeze my hand. If no response, send for help. Call EMS for ambulance. And next, we need to open the airway and check breathing. And then check the mouth is clear from any blockage. To clear the airway, roll the casualty onto their left side. And then use the head tilt and lifting the chin to open the airway. Rescue breath if she or he not breathing. So start CPR immediately. Okay, next is called chest compression. Chest compression technique you use to perform compression chest center of the chest and hand placement. Place your hand slightly to the side of the implant device to avoid direct pressure on it. And then the last one is attached defibrillator, which is we use AED. It used when it's available. Avoid placing pad directly over the implant defibrillator. And the last one is follow the instruction by the AED until EMS arrive.
My name is Siti Ayuni Kristina binti Ibrahim and my matrix number is 075660, and the second task for sketch note is to explain the considerations and adaptations of the patient with a history of allergies. So firstly, as a healthcare workers, we need to identify patients' allergies by quickly assessing a patient's medical history or look for medical alert bracelets that indicate allergies. And we may also ask any available family members or bystanders about the patient's known allergies. Secondly, as for the medication, the allergies, If the patient has an epinephrine autoinjector for severe allergic reaction, we need to always be prepared to administer it if the patient exhibits any sign of anaphylaxis. Next, to manage anaphylaxis, we need to stay alert of the signs such as hives, swelling, difficulty breathing, or a sudden drop in blood pressure. We need to ensure rapid transport to a medical facility. And then, as for the CPR adjustment, if the patient's collapse, we need to prioritize airway management and ensure help is on the way. And we must be prepared for potential swelling of the patient's airway. So, we should consider advanced airway management technique. And then lastly, as for the communication point, we must clearly communicate the patient's known allergies or any treatment that we already administered to the patient to the emergency medical services upon their arrival.